It was the hardest job I've ever done.
Wow.
The hardest I've ever done. And I've worked in
Right.
ICUs, and it was the best, but also the hardest. The best because I went to work every day feeling like I was part of something bigger than me, that I was making a difference for my population at that time was the state of Colorado.
Mm-hmm.
And that I have the potential to actually move the needle on some of these societal issues. Grateful to be in a position where I could maybe make a dent in some of those.
From PHI Media, I'm Gordon Thane, and with me for a conversation is someone who's been at the center of it all, guiding states through public health emergencies, advising Fortune 500 companies, and sharing hard-won lessons in the media and on the front lines. Dr. Tista Ghosh, and her new book, Before the Next Crisis, brings together real stories from the pandemic to show us what needs to change and why it matters for us all. Let's get into this conversation. You're listening to the Public Health Insight Podcast, your go-to space for all things public health and global health, from the Sustainable Development Goals to the social determinants of health, as well as interesting dialogues about the diverse career opportunities that exist in these fields. Remember to subscribe to the podcast and leave us a rating on Apple Podcasts and Spotify so other people like you can benefit from our content. Dr. Ghosh, welcome to the Public Health Insight Podcast.
Thank you. Thank you for having me.
So, this is where I want to start things off because I think it will lead to a fun conversation as I get to know you a little bit better. So, if there was a movie trailer of your life, it might open with a kid in Western New York sipping on chai, wondering where their next serving of mac and cheese might come from, and flying between the Great Lakes and spending time in summers in India. And then maybe we'll cut to some family stories of your grandfather and his brothers as freedom fighters in Gandhi's movement. So that's not just a childhood. I consider that a bit of an origin story if you were a superhero in a movie.
Wow.
Those are some pieces to your backstory. So help us connect the dots on those things and how it brought you together as a full human being that you are today.
Wow, sure. Well, I come from parents who are immigrants from India, and my grandfather did, with his brothers, fight as freedom fighters in the 30s, I would say, 1930s, in the freedom movement in India. And I grew up hearing those stories. His brothers all went to jail. He didn't go to jail. So he didn't get the extra cash that I guess the government gave the people who went to jail. So my grandmother wasn't happy about that part. But
Fair enough.
fair enough. But my father, my grandparents had to cross into India from what is now Bangladesh, but was Pakistan at the time when India was suddenly broken up. And so they lost everything and kind of ran in 24 hours kind of with my dad, who was a baby. And so they lost all of their land, everything they had, and came across the border in 24 hours. And so my dad had a pretty rough childhood. His parents were essentially refugees in their own country.
Right.
And his goal was to get out. And he did. He became a scientist, and he and my mom emigrated to the US in the 1970s. And I was born and raised in the US, and I grew up going back to India every other summer. But I also grew up as an American. So my parents would have to take boxes of Lucky Charms with them to India, because I refused to have Indian food for breakfast. That was just not okay. So I grew up sort of straddling those worlds, and I grew up in a place that was pretty diverse. So I had friends from all different backgrounds. other kinds of immigrant communities from Asia, Africa. And so my childhood was pretty diverse, and I am grateful for that because I was exposed to a lot of different cultures early on, and shaped who I became. I became I ended up going to medical school. I ended up becoming a physician, but I also ended up thinking that I wanted to do more than just the individual patients. I wanted to look at things from more of a population level. I wanted to see, because I'd grown up seeing lots of different groups from lots of different places. I was interested in global health. I was interested in public health. And I ended up doing a fellowship with the CDC and Epidemic Intelligence Service and traveling the world for outbreaks and just getting to meet people from different cultures and spaces, which was so rewarding, but also taught me to really listen rather than just assume I know things. Because really, I learned quickly I know nothing about whatever community I'm talking to. So they're the experts, not me. And to go in with humility wherever I was. And that kind of led me to where I am now. I ended up I worked for government for many years, but I ended up during the pandemic actually consulting with Fortune 500 companies around the country, the world, and who had frontline workers who had to work through the pandemic. And you'll remember they had mask shortages, they had all these things, and everyone was terrified. No one knew where this virus, what it did. I don't know if you remember, we would wipe our mail down because we didn't know if it was through contract, and then we didn't have enough masks, and people were wearing bandanas, and these frontline workers were terrified, and they were of this scary virus that they'd never heard of that they might be bringing home to their families, but they didn't get to stop working. And so I got to collect stories from them, really listen and hear what they were thinking and feeling. And again, that idea of humility, that of listening with humility, made me realize that a lot of the misinformation and distrust that we're seeing in public health now is a result of us not listening during that pandemic, not listening, not really listening. And the seeds of that distrust that was planted during the pandemic is blooming now in a difficult and terrible way that will probably hurt us all if we don't fix it, but is something that I think we need to reconcile with, that we didn't really maybe listen. And so the book I've recently written is the stories that I collected from throughout the pandemic of people in rural, urban areas, red and blue states of the US, and employers, small business people, policemen, nurses, teachers, just different people, and what they experienced, and what their conclusions about public health, which they'd never heard of probably before that, were as a result of how the pandemic rolled out. So I would say that's my story.
So I wanted to zoom in on a few things there. So, I mean, number one, I heard the story about Lucky Charms, but I didn't hear you talk about the mac and cheese thing. But
Oh,
I'll let that slide. I'll let
okay.
people kind of wonder about what that story is about. But I did wanted to zoom in on sort of how you got into medicine as your first entry point. Did that interest come more around like a general interest in science and that kind of developed over time, or you knew sort of really early on that there's something there for medicine, and then as you kind of learned about what the world entailed, you were clear about how you saw global health and public health fitting into that, but the first entry point being medicine? Did you always knew when you were younger that's where you would end up, or were there other things you were exploring?
I did not know that that's where I was
Mm.
going to end up. I was definitely a science kid, and my parents are scientists. And so I kind of grew up with that, but they're
Mm-hmm.
laboratory scientists.
Okay. Okay.
So not physicians. And so I I didn't necessarily know that that's what I wanted to do, but I knew I wanted to help people. I wanted to make a difference, even if it was a small difference.
Mm.
It was a difference. I recently saw a documentary about this man called the plant man in India, or the tree man or something like that in
Mm-hmm.
India.
Mm-hmm.
And it's this guy who started, he's poor, he was like
Oh.
16 years old, and he found this barren stretch of land that was
Mm.
getting destroyed. And he felt like if he just planted one tree every day, maybe he could make a difference. He had no money, he was all by himself. Every day for 40 years, he planted a tree. And it's a forest now with tigers have come back. And like the whole area that was barren and disintegrating and eroding is now fine because the trees are holding it in place. And so that story makes me think of what kind of lessons I grew up with as a child. My grandfather and all
Mm.
that was just, if you don't have to be like the president of some major country to make a difference. If you do something small in your own way, you will make a difference.
Mm.
And if we all do that, what's possible? So, how many forests can we grow? And so I think for me, I knew I wanted to do that, make a
Mm-hmm.
small
Mm-hmm.
difference. I just didn't know exactly how. And medicine at some point became, okay, well, maybe that's something that I can make a difference in individual lives in some
Right.
community. And maybe that's
More
that's
tangible, specific. You could kind of see it like a direct. Right. Right.
right. It wasn't until though that I was in medical school where I was working in a primary care clinic, and I felt like I was seeing the same patient over and over and
Mm.
over. I was seeing, I mean, they had obesity, high blood pressure, diabetes, obesity, high blood pressure, diabetes, over and over. It was like that movie, The Groundhog's Day.
Mm.
It was just the same day over and over and over. And I asked my mentor, why are we seeing basically the same patient? There are different races and ethnicities and gender, but it's the same it's the same thing over and over and over. And he said, well, that's a great question, but that's really a societal issue because we're getting it at the end, when they've already developed the diseases. But it's all these chronic illnesses are like root their root cause is a
Mm.
societal issue,
Right.
like the food supply and what's leading them to be obese, why they don't walk anymore, because we built societies that are, you have to cross an 8-lane highway
Mm.
to get from point A to point B. You can't walk there. There's all these societal reasons why we're seeing these people, and we can't change that. So as doctors, we can't change that.
Mm-hmm.
And I
Mm-hmm.
said, but who can change it? And he said, well, that's a whole field called public health. And they look at more of the root causes and the societal issues that can lead to what you're seeing. What we're seeing at the end result is clinicians. And I was like, I want to learn more.
Mm.
And that's when I ended up doing some rotations in public health. And I actually went and did one with WHO in Geneva. And I was like, this is where I feel like I
Mm.
could make a bigger difference. So that's how I ended up kind of moving from straight up clinical medicine to
Mm.
public health.
And did your preventive medicine specialty. So eventually, and I think this is a big milestone. So eventually, the Colorado Department of Public Health, you had a tenure there as a chief medical officer. And if I'm not mistaken, the first woman or one of the first women, at the time of when you were appointed.
Yes, the
Right.
first woman of color for sure. But yeah,
So that, I
the
mean, that's a big milestone. But so you get into that job, you were kind of being clinically trained, you did a pivot. Tell me about your time in this leadership role. Like it's this very instrumental state kind of public health leadership role.
yeah, it was the hardest job I've ever done.
Wow. Like just
It,
like you didn't have to think about it. You just
yeah, the
wow.
hardest I've ever done. And I've worked in
Right.
ICUs and
Yeah,
yeah,
yeah.
yeah,
Surprised by that.
it
Yeah.
was, yeah, it was the best, but also the hardest.
Wow.
The best because I went to work every day feeling like I was part of something bigger than me,
Mm.
that I was making a difference for my population at that time was the state of Colorado.
Mm-hmm.
And that I had the potential to actually move the needle on some of these societal issues that we were talking about earlier that lead to all the chronic illnesses that lead to mental health. We had some of the highest suicide rates in the country.
Wow,
We
wow, wow.
had just a lot of different issues in different populations. And I think I felt grateful to be in a position where I could maybe make a dent in
Mm-hmm.
some of those.
Mm-hmm.
So that was amazing. What was hard is the politics of it. The level of political pressure from so many sides. Colorado's a purple state. So there's very conservative, very liberal, very moderate, just lots of different
Mm.
groups, and I had to navigate those because I was just the science isn't enough. It's how you
Wow.
communicate and how you communicate to different audiences. And there were issues, vaccines were starting to come up. We had some of the lowest vaccination rates in the US. And I would say things like, we're at risk for a measles outbreak. And I would make some politicians mad by saying that. But
Right.
we
There's
were.
something with the childhood vaccinations. I know we talk about vaccine hesitancy as a big thing, but from what I'm seeing with the childhood vaccinations and what you're describing with measles, it brings you to a whole when you're interfering in parents' lives and how they want to
Oh
raise
my
their
gosh.
kids.
Yeah.
It's you're dealing with a different ball game with that one.
It was
Wow.
shocking to me. I even had issues, people, I didn't even know this was a problem with pasteurizing milk. People
Hmm.
were intensely
Right.
anti-pasteurization. I got asked, what is your belief on pasteurization? And I said, It's not a religion. I mean,
Right.
I
Right.
don't have a belief or not belief. It's just heating things
Right.
to
It's
a
not like
point where you have
what part of the
germs.
camp do you sit on? That's not how you saw it to even answer
I
that
know, I was
question.
shocked by
Right.
that.
Right.
Yeah, I was like, well, I mean, it's just heating to kill germs. It's not,
Mm.
it's not like a religion or anything.
Right.
I don't
Right.
even know what to say. I don't
Right. Right.
believe or not believe. I just is.
Yeah. Yeah.
And people were, it was intense over pasteurizing milk. I just, I didn't realize there'd be so much intense, and it wasn't just these bread and butter public health type
Yes.
things.
Yes. Yes.
It
Yes.
could be topics that you're treading, like suicide and mental health was a big,
Mm.
that could be polarizing.
Right. Right.
It could be environmental
Oh.
pollutants or even sources of renewable energy, wind farms causing illness, or then the oil and gas industry and fracking causing illness. From every angle, like nothing was not political. So
Right. Nothing was
it
like
was exact. It was
straightforward.
right. It
Yeah.
was yeah, and you had to be up on who's on what camp on every topic. Things again that you don't think are necessarily controversial were controversial. So it was like walking a tightrope every day as well.
Wow. You left that post before the COVID-19 pandemic hit. Do you ever wonder
Right before.
what it would have been like, given all what you've been describing, what it would have been like if you were still in that role throughout the pandemic under your leadership? Do you ever wonder, think
Yeah,
about that?
I think it would have been very hard. And I give kudos to all my fellow public health people who had to do that during the pandemic. Actually, in my book, I interview not just everyday people, but I also actually interview local public health
Mm.
from around the country to capture what they were experiencing.
Mm-hmm.
Their stories, some of them are not that bad. Again, it depended on where you lived.
Right. Right.
How you
Right.
experienced the pandemic was very different depending on
Right.
rural, urban, what kind of political leaning of the state you lived in. But all of them they were working 24/7, but they were also, depending on where they lived, if you were in New York, you had a very different experience than if you were in Ohio or in rural Montana, or it's just very different. In I interviewed somebody in a rural mountain town in the Rockies, and they were being stalked every day. I mean, they had people picketing in front of their house every day,
Mm.
and where they lived got leaked. They got doxxed. They were, I mean, terrified
Right.
every single day. So,
Wow.
so I give them kudos, and I'm also grateful. To be honest, that I wasn't there because
And I
I
don't
don't
I
know that
don't I don't hold that against you at all.
yeah.
Obviously you've left that post and now you're at Edwards Life Sciences.
Mhm.
You've been there for a couple of years now. What was the
Yeah.
thinking about a lot of your experience with, you mentioned intern at WHO, you kind of intersected with UNICEF, you worked with the State Department, and now Edward Life Sciences would be more in the private sector world.
Mhm.
What was sort of the thinking? Is there more to the story to that, or is it just kind of there was a good opportunity at the time that you wanted to kind of seize that opportunity?
It's an interesting story. When I left the government right in 2019, towards the end of 2019, I went to work for a startup that was working with different companies on health benefits and how to keep populations healthy, of populations of workers. So it was kind of like public health, but for workers.
Right.
And your population's different. Instead of a state or a county, it's workers. And then the pandemic hit, and I ended up becoming the epidemiologist for all these different companies. And I learned a
Right.
lot. I mean, I worked with all different industries, like the cable people, the food workers, agricultural workers, factory
Right. That's so
workers,
interesting.
delivery workers. Yeah. Like,
Because
even
it's all
like,
occupational hazards, which is like huge. It's a huge part of public health, but it gets lost in sort of the general population sometimes. Yeah. So that's really
right.
cool. Yeah. Right.
And then during that, I mean, it was like I got exposed to like almost every industry you can imagine, like from healthcare to like agriculture, like people who are growing our food, to factory workers packaging stuff, delivery workers, like who delivered our stuff, grocery workers, just and like the people that basically kept our
Right.
countries
Right.
running.
Right. Right.
But like we didn't, even the garbage collectors, like all of them, like we just didn't think about them, but they were constantly working. And during that time, in 2021, Edwards Life Sciences, which was at the time one of the largest manufacturers of heart valves, as well as ICU equipment at that time in the world, reached out to me, and they just found me through like the networks that I was working in at that time, and said, we need help keeping our plants open around the world, because if we don't keep those open, that's hospitals not getting
Right. Right.
ICU equipment
Okay.
and heart valves.
Uh-huh.
Would you consider working for us? I felt like they were very mission driven, and it sort of intersected the clinical world with the public health work that I've been doing. So I became in charge of employee health for AdWords, and that meant global public health because they had workers around the world,
In
around
different
20,000
contexts,
different.
different rules, thing, and everywhere, different people, cultures.
Yes.
Wow, that
It
must
was
be.
like the culmination
Yeah.
of kind of my raw background and experience, and I love it.
Mm.
But yeah, we had to keep that, and I will say, not a single plant shut down during the pandemic. They worked at 75% capacity, but they kept going. And it's a very mission driven place. They're patients first. So if we don't keep those plants open, our patients die. So it was, yeah, for me, I suddenly went from more US focused work to, oh my gosh, they don't have vaccine in Costa Rica, or they don't have, the border between Malaysia and Singapore shut
Mm.
down, and we had a factory in Singapore, and most of the workers were crossing the border from Malaysia. And then we
Okay.
had a 24-hour notice that the government was shutting down the border between these two countries, and basically say to the workers, if you want to still keep working, you have to come to state. We'll put you up in a hotel, I guess, and just
But not
decide if you
moving
want your
across.
family, not family. Yeah, they won't let you back. And so most of our workers came, and they're the people who sew the heart valves, hand sew to fit people. So they're very skilled workers. You can't just replace them. They're very practiced and skilled. Under a microscope, they
Wow.
they sew heart valves. So they most of them came, but we didn't know how long. And it ended up being almost a year or even a little longer that border was shut down. I I had to deal with workers in China who suddenly were locked down in their homes, and the government was supposed to deliver food, but sometimes they didn't have food because it didn't get to
Wow.
them. They didn't have grocery stores open. They had nothing. And just dealing with that, like workers who don't have food.
Right.
So it just suddenly going from very US centric to
Right,
global
right, right.
was it kept me on my toes for sure, but it was also super rewarding, challenging but rewarding. So I'm still there now. Work with them on other health threats, whether it's natural disasters or with climate change. We're seeing like dengue and other weird viruses that normally you wouldn't see in one part of the world
Right, right, right.
entering a different part. More natural disasters than we've seen, but also chronic illnesses, keeping the population as healthy as possible so that when something like that does hit, you're more likely to weather it.
Dr. Ghosh, we're here because you wrote a new book before
Mhm.
the next crisis, but it's not your first book. You've written one previously called Awakening Kali.
Mhm.
Did I get it right? And
Yeah.
so, if I was to ask you, and that would have been, I believe, 2016 ish, somewhere around
Yep.
there. If I was to ask you, sort of, obviously, storytelling is part of one of the mediums you use in your writing to communicate experiences, thoughts, ideas. Are there any? Is it too much of a stretch to ask you if there's similarities between your first book, which was fictional, but
Mhm.
had elements of truth in there,
Yep.
to this one, which is completely narrative based on realities of people's experience during COVID? Are there similarities in the content itself, your approach to writing the books? How would you reflect on that?
I would say the commonalities are they're both about health.
Mm,
They're just and they're both stories. They're both stories about health, teaching the reader through storytelling.
mm.
I really strongly believe in a show don't tell approach.
Show,
So
don't
I like
tell.
so a lot of books about health are some expert telling you something, and they're or pundits analyzing something and giving you their perspective. And part of what I've learned in my years in public health is telling people what to do isn't effective. It's showing through stories and experiences. First of all, listening to actually get those stories, but also then showing people through stories is far more impactful. And I learned that in my time at government, where I'd have to testify before, various legislative committees, and I'd share all my stats and they would glaze over. And then I tell a story. It would be a story, either my own story or a story of one of their constituents and that would always get them far more than any statistic I ever gave them. So I would say in both of those books, I use stories to teach about a health related topic. Awakening Kali is a story based on my grandparents. It's fiction, but loosely based on my grandparents, and it's about mental health. It's my grandmother had mental illness and believed she was cursed by a goddess, Kali. So it's their story, but it's through that storytelling lens that I give a broader picture of mental health issues. And then before the next crisis is nonfiction. It's real stories, but it is stories. And in this, it's the the stories of what happened during the pandemic to real everyday people, and what the consequences of mixed messaging, of confusion, of potential politicization of public health caused, and how that led to deep, deep distrust of both public health and healthcare systems, and how that's kind of led us to where we're kind of this anti-science, anti-expert, anti
Anti-everything.
anyone telling me what to do. Yes, it is. And I think the book is written so that I'm not telling you this. You'll draw your own conclusions as you go through these stories. You're like, well, no wonder they hate all the public health people, or no wonder they hate all government officials, or no wonder they don't believe doctors anymore. Or, I mean, you will draw your conclusions, not because I'm telling you, but because through the stories they're telling you. And so it's like I said, a show don't tell approach to writing.
Okay. And we'll talk about that more in a second with the scheduled break. You ready to have a little fun with our Insight Blitz segment?
Sure.
All right. So, Dr. Ghosh, welcome to Insight Blitz, our rapid fire segment where I will ask you questions or read some statements and you'll provide a brief response. You ready to go?
I'm ready.
Ready. All right. If you had to choose an alternate career in an alternate universe and it couldn't be preventive medicine, public health, what would it be?
I would probably be a writer and a documentarian. I love writing, as you can tell, because I do write still. But I also I love film and capturing people's stories. That's a big passion for me, and I don't think it just has to be in one medium.
And one might argue that you are living both careers at the same time with the writing, and that actually ties into the second question. If not through writing, your favorite way to express your thoughts, ideas, and creativity would be?
One of the things that came out for me as a result of Before the Next Crisis, writing that book, is that I realized, I probably already knew this, but I truly realized that nobody gets their information from experts or sources that I used to get my information from. Like, they're not reading books about it. They are getting their information on TikTok and Instagram. And for better or for worse. And who's out there on TikTok or Instagram? It's these people who have a lot of times no expertise on anything. They're either selling some shady supplement, or they're just making something up. And that's another reason we have all this disinformation or misinformation out there. And I feel like people who are experts need to come out of their ivory towers and actually speak directly to people. Podcasts are one way that you're doing that, but a lot of people don't. Doctors don't. These experts don't. And so you just have this broad majority of people receiving their information from these random people who have no actual scientific background, and they're not trusting or getting information from the actual scientists. And it's because we're not really taught to communicate directly to the public,
right.
which became very clear during the pandemic. So I think I decided I needed to walk the walk and talk the talk. And so I started an Instagram channel, which my kids are my social media consultants. But I do make short videos as a way to directly speak to the public rather than through kind of more academic channels.
Which ties into the other one. It's almost like I knew what you were going to say before you said it. The next one is actually, what's one health myth that you wish you could erase from public consciousness forever? And then what's one that you wish got more attention because it was factually true?
Oh, Well, I mean, there's so many health myths right now. I can't like. I'm like, which one do I pick?
Vaccines,
Um,
maybe.
I'll go with vaccines. Yes, I think that one is shocking to me. The level of myths that are out there, and it's. I thought originally it was just going to be for the COVID vaccine, which
Right.
I kind of understand that one because it was a new vaccine. It was kind of came
And then
out really
everybody's
fast.
talking about vaccines at the exact same time, which probably has never happened at any other point in history, probably.
Ever, right? So I
Right.
get that one. And it was new and it was scary. So I get that one. But now we're going back on ones that like have been around for 50 years. And you're like, okay, why? The one that recently and a lot of times they take a kernel of truth
Mm,
and then they turn it into
mm,
this major issue. I'll
mm,
give you an
mm,
example. Polio vaccine. It's been this like, I mean, the conspiracy theories are thick. And they're all like, all polio nowadays is caused by the polio vaccine. And there's a tiny, tiny kernel of truth in that.
mm,
If you go to like parts of Africa or Asia where they're using oral polio vaccine, it's a live virus vaccine, but it's easier to carry around. You don't need the level of refrigeration and it's easier to give out. And so they've decided that there's a like a one in a it's something ridiculous, like 1 in a million or 1 in 2 million. I don't
mm,
remember the exact number chance that from that oral polio vaccine, because it's a live virus, you could get it. And those governments have decided that the risk of actual polio is higher than the risk of getting it from the vaccine. So they have chosen to give oral polio vaccine. Whereas in the US or most developed countries, because the risk is so low, we don't even give oral
mm,
polio vaccine. We give the injected one. And so it's inactive. It's not causing polio. And so these American, Canadian influencers are like, oh my God, we're all giving each other polio with this vaccine. You're like, no, you're not. We don't even give the oral polio vaccine here. Like, and yet they don't remember what polio was. So I've seen it. It's paralysis for little kids. It's the reason the ventilator was invented because people couldn't breathe. It's horrible.
Though, yeah, I've seen
Um,
those I didn't live through those times, but I've seen a couple documentaries. I've seen enough. Don't need to see it again. I get it.
Yeah, it's horrifying. Like ask your grandparents who were alive and people lined up to be like, give me polio vaccine because it was so terrible.
Mm,
And people don't remember and then I don't know why. It's ripe right now to spread disinformation about
mm,
diseases we'd already conquered for the most part. And
mm,
now we're just bringing them back and
yeah.
it's little kids that will suffer as a result of that.
Yeah, that's an interest. I still won't get that one too because on the same or on the other hand, a lot of what you'll hear too is a natural infection is okay. So then in theory, if there's a live virus that's weaker and you're kind of looking at risk tolerance, you'd think you would still go for the vaccine because it's a
Right.
more controlled way to get sick if that's what you're concerned about. But anyway, that's a story.
Yeah, it's
You,
it's crazy,
it could it's
and
a
that
field
brings
in of
me.
itself to be studied. Yeah.
It is, but that brings me to your second question about what do I wish could be spread.
Hmm.
The truth, which I actually think these vaccine myths hide, that the source of a lot of our chronic illnesses today is food. It's our diets. It like all pretty much heart disease, many cancers, diabetes, all of these things are food related. I almost think the vaccine thing is a distraction. So we're go on eating the junk and the processed ultra processed foods and the crap, I'll say, that lead to all these chronic illnesses. And it's a distraction. If I were a conspiracy theorist, I'd think it was like the food companies that were
Right, right,
that
right.
planting this. No, I don't really think that, but yeah, I mean, yeah, it surprises me that they're going after a vaccine, but they're not going after
Hmm.
food, which actually, I mean, like 90% of our chronic illnesses and even mental health could be better if we ate better. But we don't hear about that
Right,
at
right. We
all.
don't.
There's
That
there's no conspiracy videos about that. So
so interesting. That's a sociology stuff. Anyways. I'm fascinated by that stuff. Now, okay. So that brings us to the end of Insight Blitz. I think we had fun with that. Maybe a little bit too much fun. You're smiling, so I take it as you're gonna stay with me for the rest of the episode.
I'll stay with you.
Conversations like this remind us that public health is as much about understanding people and their stories as it is about science and policy. Dr. Tista Ghosh's journey from navigating cultural identity to leading through political and social challenges highlights the importance of humility, clear communication, and truly listening to the communities that we serve. Coming up next, we continue our conversation with Dr. Ghosh as she shares how storytelling can be a powerful tool for teaching and building trust, why public health messaging often falls short, and what it takes to cut through misinformation in today's world. We'll also dive deeper into her writing process and the real-life stories that bring life to her book, Before the Next Crisis. That's next time on the Public Health Insight Podcast. This show was edited by me, Gordon Thane, with additional editing from LaShawn Benedict. Sound design and mixing by myself and LaShawn Benedict. The original music from The Music Room, composed by Tom Fox, licensed from Johnny Harris. The cover art designed for our show by LaShawn Benedict. The Public Health Insight Podcast is produced by PHI Media. Thank you for listening to the Public Health Insight Podcast, your go-to space for informative conversations, inspiring community action. If you enjoy our podcast, be sure to subscribe and leave us a rating on Apple Podcasts or Spotify. See you in the next one.